Hello everyone, my name is Gauri from the Kirk Center, and I was featured in the last video, and I talked to you about constipation, and we demonstrated some poo-poo mechanics, and I talked about the definition of constipation. And I had mentioned that there are some things that we can do dietary wise to kind of help things. And so today I'm going to talk to you about fiber. This is Steve, my boyfriend. He was featured in the last video, and he so awesomely demonstrated some bowel mechanics for us. He is also a scientist, and in particular, what do you do, Stevie?
I research cancer.
Yep, and he knows a lot about this kind of stuff because he knows a lot about colon cancer. And one of the things that they do for colon cancer patients is to really recommend a high fiber diet. But everyone should be having fiber in their diet, and that's the thing that you can do to make your stools to improve the frequency of your stools and improve the consistency of your stools so they're easy to pass and your tummy's happy and you're good to go every day. So fiber is a substance that doesn't really break down in your digestive tract, and there's two different kinds. One kind is soluble fiber, which is water soluble, and it goes through the gut. It sucks up the water from your colon and turns your stool it bulks up your stool and turns into this gel-like substance that is easy to pass. And some examples of soluble fiber are
Whole grains, particularly oats, mushrooms, nuts. What else? Lots of berries actually have a fair amount of insoluble fiber.
And oat bran.
And oat bran.
So for my patients, you guys know how much I talk about oat bran and how much I love it. But it is also a good source of soluble fiber. We also have chia seeds. Chia seeds are a really great source of fiber, and flax seeds are also a great source of fiber. And they both have soluble and insoluble fiber in them. And insoluble fiber is kind of like roughage. It's like it doesn't really break down in your digestive tract at all, and it I think of it as like a bristle brush for the inside of your colon, and it cleans everything as it comes down, and just keeps you have pretty clean bowel movements. And so, with that said, we are going to make us a smoothie that has a good source of, it's a good source of fiber in general, but it's going to have spinach, bananas, chia seeds, flax seeds, and we'll add some stuff for this other stuff we usually had for flavor. But stay tuned, and we will film that and share with you in a minute.
Hi everyone. So we're going to be making our smoothie. So soluble fiber is really great, and there's a lot of it in chia seeds. It's super good because it actually lowers your cholesterol. So your body makes these things called bile salts out of cholesterol, and they're really important in helping you absorb fat in your diet. And soluble fiber will actually suck up a lot of this stuff, and you'll remove it from your body. So it's kind of a way that your body gets rid of excess cholesterol, and it's really healthy for your heart. And insoluble fiber, like the stuff that's found in vegetables such as spinach, it's spinach, celery, anything that's kind of like roughage, like vegetable matter material. It's really good because it lowers your risk of getting colon cancer, actually, and keeping you regular actually decreases your chances of getting colon cancer in general.
So this is our smoothie. We have about a cup and a half of spinach, about a cup of almond milk, about a banana and a half, about half a cup of berries, about a tablespoon of peanut butter, 2 tablespoons of flax, and 2 tablespoons of spinach. And we normally add a little bit of cinnamon because I like it for the flavor. And sometimes we add a pinch of salt just to bring out the sweetness of it. And we're going to blend, and we'll show you the result in a second. All right, stay tuned. All right, so while we're waiting for the smoothies to be done, I'm waiting for Steve to blend them. I'm going to talk to you a little bit about how much fiber we're actually supposed to be eating. So according to the American Heart Association, we should be getting around 25 to 30 grams of fiber daily through diet. When I worked with the colorectal surgeons that I did, they were recommending around 26 grams of fiber for a female, or like anywhere between 22 to 26 grams, I guess. And for men, they were saying that you should be eating around 28 to 32 grams of fiber. And so if you can't get that from your diet, you can add a like dietary supplement to your diet as well. And I will talk a bit more about that in the next video. And I'll talk about like what over-the-counter supplements there are, and how they're different, and how you can incorporate them into your diet, and some other benefits of them as well. All right, so there you have it. That's the like dietary recommendations of like the amount and dosages, and we'll go back out there and we'll have some smoothie. So this is the final result. This is what it looks like.
It's pretty thick.
Pretty thick, but not bad. You can also freeze your berries, and we use frozen berries, but freeze your bananas beforehand, so you don't have to put ice into it or anything like that. That's typically what we do. And bon appetit!